Today we are going to be talking about lymphedema, what you need to know. This video is brought to you by Oncology Rehab and Wellness Resources, Northern Virginia's only private physical therapy practice specializing in the treatment of cancer patients and survivors. What is lymphedema? Lymphedema is the collection of lymph fluid just beneath the surface of the skin. This fluid causes edema, or swelling, in the limbs of the body, most notably the arms and legs, but it can also occur in the head, the neck, and the trunk. It is broken up into two categories, primary and secondary. Primary lymphedema is not directly related to another medical condition. It is further broken down into congenital lymphedema, which is seen at birth, lymphedema pericox, which is seen most often in females ages 9 to 25, and lymphedema tarda, which presents after the age of 35. Secondary lymphedema, on the other hand, is a result of blockage or interruption in the flow of the lymph through the body. It can be caused by infections like cellulitis, cancer and the treatments associated with cancer, surgery, and trauma. This form of lymphedema is the most commonly seen type of lymphedema, especially among our patient population. So when a patient develops lymphedema, we typically see swelling in the affected extremity, tightness, discomfort, and at times there may be an unusual tingling sensation and poor wound healing. Typically, lymphedema is associated with patients who have been diagnosed with cancer and the treatments associated with cancer. However, non-oncology patients who suffer from infections, trauma, and cardiovascular disease and with a genetic predisposition can be affected by lymphedema as well. It is important to note that while lymphedema is commonly associated with breast cancer, it can occur in other cancer patients who have had lymph nodes removed or have had radiation therapy. So what? Well, lymphedema can greatly affect the lives of patients. Clothing does not properly fit, skin becomes tight, there is a noticeable decrease in movement and flexibility of the affected area, and the discomfort associated with lymphedema can be unbearable. Left untreated, lymphedema can begin to cause tissue damage or fibrosis, which causes further complications and affects the integrity of the skin. But with proper diagnosis and quick treatment, the affected limb can usually be restored to a manageable size and shape. Treatment can also assist with the management and control of lymphedema, keeping it from progressing to a more debilitating stage. Treatment plans are developed based on the stage and cause of lymphedema. The standard of care for lymphedema is complete decongestive therapy, commonly referenced as CDT. CDT is a combination of manual lymph drainage, compression therapy and bandaging, exercises, and skin and nail care. The program starts with an intensive treatment plan and is then followed by patient-controlled maintenance. Manual lymph drainage is gentle, manual treatment used to reroute lymph flow from blocked areas in the area to healthy lymph vessels. Compression therapy and bandaging uses multiple layers of bandages wrapped around the affected limbs. In between treatments, the pressure around the tissues is increased, helping to stop the reaccumulation of the rerouted fluid. Remedial exercise is emphasized during times when the limbs are bandaged. These exercises, along with the compression therapy, help lymph fluid return to the circulatory system and away from the affected limbs. Infections can cause the lymphedema to worsen or further complications to develop, so outstanding personal hygiene, including skin and nail care, is imperative. Lymphedema can be a serious complication and should not be left untreated. Oncology may be in our name, but we are here to help you with your lymphedema no matter the cause. Our certified lymphedema therapist is here to help you get back to a better you. Make us part of your care team. Thank you for watching. Please make sure to like and subscribe to our channel. We put out a new video every week.